Welcome back to Midday Kentucky. Clark Regional is a chest pain accredited facility, which means that they are able to provide higher quality care to patients. Dr. Hazim Rishmawi and Nicole Scott are both here this morning to explain why. Thank you for being here. I guess it's afternoon. It's not really morning anymore, is it?
Good morning. Thank you for having us.
So what exactly does it mean for an emergency department to be chest pain accredited? What exactly does that mean?
Chest pain accreditation means that we have a standardized process that when a patient arrives, whether it be through the emergency room registration or through EMS, that we have a process set in place to automatically check for cardiac problems with an immediate EKG. Right. It allows us, we have a special bond with UK, gets them to UK if needed, if the EKG shows up abnormal or any blood work shows up abnormal. But the standardized process starts from the beginning in registration all the way out through our transport teams to get them out the door, to get them to the cath lab.
Gotcha. And what does it take to get that accreditation?
Well, it's a very long and arduous process, actually. Okay. We spent an entire year worth of work prior to receiving the accreditation, getting everything up and running up to speed. It took a multidisciplinary team from hospitalists to administration, nursing staff, the ER physician, which is myself, the cardiologist, which is Dr. Charles Salters, and in conjunction with University of Kentucky, all kind of making this process happen. It took a lot of man hours.
I bet. I bet. Now, let's talk about your affiliation with the UK Gilhart, and how exactly does that affect the care of the patients that are coming through the emergency department?
Well, really, as Nicole had stated, it kind of makes it very streamlined for us. We have a very special bond with Dr. Ziada, who is on the chair for interventional cardiology over there at UK, and he's made it an open door for us. You know, whenever we have concern for an ST elevation, myocardial infarction, or a STEMI, a big heart attack, we have an open door to say, hey, we've got this going on. We just hop on the phone and call them, and they take them immediately.
Which is so important.
It's very important because time is muscle.
Right.
Well, so walk us through the process of what happens. A patient comes in with chest pain. What happens from there?
So the patient comes with chest pain, whether it be through the front door or the back door. We immediately get an EKG. Our goal, and I say our goal because we have exceeded our goal, is 3 minutes or less to have the EKG done and read by a professional, which is our doctors. And then once it is verified that it is a STEMI, we have a process that we call a Stemi Code. All hands on deck. We get all the medications needed. Our patient care advocates get us transportation. Our doctors get on the phone with UK Cath Lab, get the lab open, and within less than 30 minutes, which is another goal that we succeed every day that we have a STEMI, they're out our door and on their way to UK to the Cath Lab.
And I mean, how long, once they're out your door, how long is that process for them to get to the other facility typically?
The process, if they're going ground, is usually less than 30 minutes. They're usually in the cath lab in under 90 minutes. Standardization is under 120 minutes to the cath lab. So once again, for the last 3 years, we have met that standardization and beat that standardization by about 30 minutes per patient. And then we are receive reviews the very next day with the pictures and everything that was performed. And then once a month, all of our administrations and our directors and our hospitalists and providers meet and see if there's anything we can do different to improve the next process.
Well, before we go, doctor, do you have any advice for if someone is experiencing chest pain, when to seek help or go to a hospital?
Oh, yeah, absolutely.
Always, okay.
Exactly, always.
Always, okay.
If
some people I think worry that if they should go in.
Yeah.
So if you're having chest pain, the first thing you do is call 911.
Okay.
Because EMS can do an EKG just like us, and if they have any questions, they can fax it to us.
Okay.
So we can get immediate response time from your door and say, yeah, this is a STEMI, and they'll just take them straight on. So bypassing the need to come to a hospital, spending 30 minutes in traffic or whatever it is, just head straight on. So if you're having chest pain, the best thing to do is call 911.
Well, we appreciate you, both of you, taking the time to come on the show today. We have all the information up on the screen so you can get more tips and learn about what they have to offer over at Clark Regional. We'll also post this over on our website and Facebook page. We, again, appreciate your time.
Thank you all very much.
All right, we're going to send things to break, but on the other side, we have your What's Poppin' Entertainment Report. We'll be right back.